The Minister of Health's statement before Shura Council today focused on ministry's achievements over the past 4 years, investments in health sector, implementation of Health Vision 2050, its challenges, ways of achieving its objectives, and the ministry's efforts in combating COVID-19. His Excellency the Minister of Health presented his statement today at the Shura Council, where he highlighted on the process of humanization and provision of medical and technical jobs at the ministry, the availability of medical cadres and the training programs, the areas of enhancing healthcare at various levels in various governorates, healthcare at the primary healthcare level, promoting healthcare on the level of secondary and tertiary healthcare, further developing accidents and emergencies departments, established rehabilitation and physiotherapy centers in various governorates of the Sultanate, providing the medical equipment and medicines for rare chronic diseases in various governorates of the Sultanate. His Excellency said that humanization rate has reached 72% in the Ministry of Health, with a total worker count of 39,413. In 2016, this amount was 69%. The minister said that the current rate of occupancy at the 4 tertiary healthcare hospitals is at 70.7%, with a maximum of 77.8 witnessed so far. The Royal Hospital in 2019, 15.7 million visits were paid to outpatients clinics at an average of 43,000 visits per day. 118,000 surgeries were performed in 2019, up from 111,000 surgeries in 2016. 42% of these were major surgeries. Dialysis units have been increased to correspond with an increase in patients requiring the procedure. Oman has also recorded an increase in the prevalence of diabetes, blood pressure, high blood pressure and obesity. He also said that Oman has constituted a special medical committee to examine patients with certain medical conditions before taking the decision to send them abroad for specialized treatment. In 2016, 890 patients were treated abroad, while in 2019, 905 patients made the trip out of Oman. The Minister of Health is also preparing the 10th five-year plan, which will include proposals for new projects. However, this is governed by the overall economic conditions in the country and the extent of improvement. The minister listed out the challenges faced by Oman in the health sector as follows: challenges related to financial resources, challenges related to health problems, challenges related to health services, challenges related to health human resources. Finally, His Excellency the Minister of Health took the opportunity and pledged to His Majesty Sultan Haitham bin Tariq, may Allah preserve and protect him, to pursue working to achieve a high level of health for his loyal people and residents of the Sultanate, and for Oman to benefit from health development and returns in various aspects of social and economic progress. It's worth mentioning that before the statement of His Excellency the Minister of Health, His Excellency Khalid Al-Ma'wali, President of Majlis Shura, pointed out that the health sector is one of the most important sectors that most of the countries are interested to achieve a high level of efficiency, effectiveness and progress. His Excellency also indicated that the discussions of their Excellencies, the members of the Shura Council, aims to come up with a joint practical vision that contributes to the efforts made by the Minister of Health to achieve what everyone wants under the leadership of His Majesty the Sultan.
There is a few points that we have discussed today again on the future plan that 2020-2025. Now, what's the plan for Ministry of Health we're going to do regarding the new vision of Oman 2040? Hopefully that we're looking forward to see the new plan with a certain criteria that the country has to focus on regarding the certain operation that people have gone to certain country to have a treatment there. Hopefully within coming 2 to 5 years time, we see all of these medication, what they say, what they're going to see that is going to be here within the country.
We thank the Supreme Committee and the Ministry of Health for their excellent work, and we appreciate the community response in following precautionary measure, we strongly request the community to continue following preventive measures.
So today, Shura Council hosted the Minister of Health and many topics were discussed. Among them, the current procedures that followed by the Supreme Committee of COVID-19. Also, we discussed the importance of investment in health and medical security. At least we hope that we see such projects to provide the minimum requirements of the local markets. Also, we discussed the lower rates of Omanization in private health sector and the importance of raising these percentages since we have the higher number of employment rates in the medical sector and also in the other sectors as well. We also discussed the lower rates of Omanization in private health sector and the importance of raising this percentage. And the minister replied that there are some great efforts with the Ministry of Labor to raise this percentage. However, he also mentioned that the competency and readiness for the graduates should be at high levels, so in order for them to gain the chances to be employed.